Hello and welcome to the Oral Health Podcast. Now today I am talking to another person with lived experience of an eating disorder. I'm talking to Rhian, who has been diagnosed with both anorexia and bulimia and is now in recovery for both of those. She's been very open with me about how she feels her oral health is the lasting legacy of her eating disorder and shares some really good information. I hope that you get a lot out of this conversation because I know I did. So thank you for joining me today. Do you want to just give a little rundown of who you are and your background?
Yes, so my name's Rhian. I'm 39 years old and I live in South Wales. So I've got a long history of eating disorders. I've been recovered now for approximately 10 years, but suffered with anorexia and bulimia from the age of about 14. So was ill for the best part of 15 to 20 years, but have had treatment in a variety of settings, as a day patient, inpatient, outpatient, but I had my last inpatient treatment back in 2010. So have been on the road to recovery since then.
That's brilliant. And when you you said you've got a long history with eating disorders, how did you find that having an eating disorder like anorexia and bulimia affected your dental health and your oral health?
So the eating disorder obviously had a significant impact on my teeth, and it's probably the biggest legacy that I've got left from my eating disorder now is the impact that it's had on my teeth. So I've spent probably the best part of about £6,000 on my teeth already since being in recovery. So I think I've lost five or six teeth. I've got about 10 or 12 crowns on my teeth, and I'm in the process of going to have dental implants for the teeth that are missing. So it's been a very long and painful process in terms of the impact that the eating disorder had on my teeth. Whilst I was unwell, I was obviously trying my best to keep my teeth or my oral health in as best condition as possible. But when you're vomiting multiple times a day, that's obviously going to have a long-term impact on your teeth.
So when you were going through your journey with your eating disorder, how did the eating disorder affect how you took care of your mouth in terms of was brushing more difficult or generally keeping it clean and things like that?
Yeah, so I think it's fair to say when you're in the midst of an eating disorder, self-care isn't really very high on your priority list. So there were times when I probably didn't brush my teeth as much as I should. There was also kind of the worry when I was really unwell in terms of using toothpaste and how many calories that would have in it. I also found that because I was vomiting so often that obviously the advice has always been that we shouldn't clean your teeth straight after you've been sick, etc. So when you're kind of being sick kind of 10 to 12 times a day, there's not really much space in the day to give your teeth a clean. So yeah, it was really difficult, I guess, to stay on top of things. And I think the other thing for me was sometimes when I wasn't in a good place and I didn't want to eat anything, one thing I would occasionally or most days would have is kind of a lollipop or some sugar or something like that, because that would kind of keep my sugar levels up to get me through the day. So that obviously had a negative impact on my teeth as well. So I think it's fair to say that when you aren't well, that your oral hygiene as well as your kind of physical health and all the rest of it just isn't top of your list. You're just so engrossed, I guess, in the eating disorder that nothing else really matters. So taking care of yourself, whether that be with your teeth or with your body or with anything, just kind of falls by the wayside, I guess.
You're so right as well. It's with anything mental health related, it's the motivation as well to have the energy to do it. And if you're not having the energy to get through the day as it is, it's like an extra step to get that done, that sometimes it's just not the priority that you've got.
Absolutely, yeah.
Yeah. When, because you said you've been on your journey with your eating disorder for a long time, and over that course of time, how did you find going to the dentist was when you were struggling with your eating disorder? How was that experience?
So I moved to Wales to go to university when I was 18, so I'd only been unwell for a few years at that point. And I registered with a dentist in Cardiff, where I was living at the time, and I've still got that dentist to this day. So the dentist, I've always been quite kind of honest and open with the dentist, so he's aware of the issues that I've had. Kind of always tried to give me advice in terms of what to do, what not to do, etc. But he's carried out all the treatment, etc. on my teeth. He's always been kind of quite open with me in terms of saying, you know, we could take this tooth out now, or we could leave it for now and see how it goes. You know, is I think the worst part prior to me having all the treatment on my teeth was that I was having constant infections in my mouth. So I spent, I don't know, a good 3, 4, 5 years pretty much on regular doses of antibiotics to try and get rid of infections before having kind of the root canals and the crowns done on my teeth. So I guess I was lucky. I was lucky because I managed to have a dentist, and I've had the same dentist throughout, but two, he was always kind of at the end of the phone. So if I needed something, quite often those antibiotics could be prescribed without seeing me, because he knew it was another infection, etc., etc. So I think, you know, I think it was difficult at first because when I first moved Cardiff, my teeth were already starting to decline, and I hadn't seen a dentist for a couple of years. So when I went and they were like, well, you need, you know, X amount of fillings, etc., etc., then it was a bit of I guess a reality for me that it was starting to impact on my teeth, but obviously not a big enough impact for it to change anything. So yeah, having the same dentist has been helpful because, and even now, even though it's kind of over an hour's drive away from my house where I live now, I've stayed with that dentist because I guess he understands what I've been through and he's done all the work on my teeth. So I wouldn't want to change dentists now because it's tricky for them to kind of to look and kind of see the state of my teeth, I guess, at such a young age.
It's really encouraging to hear that you've had a good dental experience, and that you've been lucky to find someone that's really understanding and really encouraging and giving you the kind of advice which is helpful to you in your situation. When you're saying about advice and things that you were given, is that just the kind of stuff you said earlier about, like, oh, don't brush straight after vomiting and things like that, or what other kind of advice did they pass on to you?
Yeah, that was, I guess a lot of the advice was kind of just more generic. So I'm just trying to think back in terms of what we talked about, but you know, he was aware that I had an eating disorder. I didn't kind of hide that because I guess the question was asked in terms of what's happened to your teeth, because you know your teeth were all right a few years ago and now they're not looking too good. And I just explained at that point that I'd had an eating disorder for a good few years, and this was obviously the impact of that. You know, he kind of, some of the stuff that he said was kind of not really relevant in terms of not drinking kind of loads of sugary drinks and stuff, which I didn't do anyway. But obviously I did say to him, well, I do sometimes eat quite a bit of sugar just because that's my way of keeping going during the day. I guess I just explained to him in terms of, you know, sometimes I'd suck on kind of boiled sweets and stuff just to kind of help me through. And he, you know, he taught me through in terms of, well, if you're able to brush your teeth after eating those sweets, that's a good thing to do. Obviously we didn't talk in massive details in terms of vomiting, but he did obviously ask the question, or do you vomit? And I was like, yeah. And I said, but I know not to clean my teeth straight after, etc. I do use like mouth washes and stuff.
It sounds like you've had, like I say, a really good experience with your dentist, which is lovely to hear. Do you have any advice for a dentist that might suspect one of their patients has an eating disorder just off some of the signs in the mouth in terms of how to approach the topic? Is it best to, or is it best to wait and let them bring it up? Or what advice do you have about a dentist that might be in that position?
Yeah, I think it's really difficult because nobody wants to make assumptions, but I guess I don't know how much training kind of dentists receive in terms of eating disorders. I know having been kind of involved in some of the beat work around GPs, obviously they get a very, very small amount of training, and I don't know how that sits in the dental world, but I guess I've always been, and especially kind of since I've been in recovery, been really quite open about my eating disorder, whereas you'll find a lot of people with eating disorders really aren't open about it at all. You know, my advice, I guess, for dentists is to try and broach the subject sensitively. You know, I think my dentist pretty much just asked the question straight out. You know, there's been a significant decline in your teeth over the last couple of years, like what's been going on, kind of thing. You know, some people will say, some people won't, but you know, if there's an obvious decline in people's dental health, then there's a reason for it, isn't there? And if that reason is suspected to be an eating disorder, then you know, I think it's appropriate for a dentist to raise that and have those conversations, and actually that might help the person, because for me personally it was a bit of a relief to know that he knew why my teeth were a mess, because it was embarrassing, I guess, for me, you know, like at times you know, having to go back and forth for various infections and losing teeth and having loads of fillings done, etc. You know, I knew I wasn't taking care of my teeth, and I knew I was doing things that were making my teeth bad or making them worse. For them to understand and know why that was almost made it easier for me to deal with, I guess, that, you know, they don't just think that I'm sitting there eating loads of sugar and loads of chocolate, and do you know what I mean? Or it kind of made it I don't know, easier to deal with, I guess.
Mm-hmm.
Yeah, well, I guess it's a really difficult one because I know what it's like to be in the grips of an eating disorder, and I know that self-care and looking after your teeth really isn't your top priority whilst during that time. But people always say to me, do you regret having an eating disorder? And I absolutely don't, in terms of, yeah, it's taken so much of my life away, but it's made me the person that I am today. But my biggest regret about my eating disorder is the impact it's had on my teeth, because that's a lasting legacy that's been left with me. So I guess it's just for people to think about the impact that it may be having. I'm not naive enough to think that will stop people when they're in the grips of an eating disorder, but you know, some people will put their dental needs completely to the side and not go to the dentist for years whilst they're unwell. But even going and getting the help that's needed for your teeth during that time will help you longer term. So I guess it's just about ensuring that you don't completely forget about it. I mean, if somebody said to me back then, do you realize, well, people did say to me back then, do you realize you're destroying your teeth? And I was like, well, I don't care. Do you know what I mean? It didn't have any impact on me. It didn't make me think in any way differently, because that was the way I was thinking at that point in time, and I couldn't change that because I was so unwell. But you know, it's been a long journey, I guess, for me in terms of trying to fix my teeth. And even, you know, over 10 years down the line into recovery, I've still got, you know, 6 implants to be completed and various other bits and bobs to do. And you know, the cost of dental treatment is so high that I guess, you know, just think about it. That's all I can say. Nothing's going to change somebody's, you know, when they're unwell, but the impact it does have on your teeth is horrific. And just try and keep up with kind of everything dental check wise, etc. Because that's all you can do.
Yeah. And how do you feel about your teeth now?
So they still frustrate me an awful lot. You know, I'll be glad once I've had the implants done, because everyone says, oh, I was talking to a friend at work about it the other day, and she said, I'd like to go and have an implant where I've got a tooth missing. because it'll look better. Nothing that I've ever had done on my teeth is anyway kind of about how they look. It's just to prevent pain and to be able to let me eat, etc. So I guess my teeth are my teeth. I kind of accepted that there's always going to be problems with them, and it's still going to cost me thousands and thousands of pounds to get them sorted. But I guess that the frustration for me is that they are the legacy of my eating disorder, in which I'm never going to change now, because you can't change your teeth, can you? So that's at least they look okay, and they're working pretty much okay at the moment, and I'm not going through infection after infection at the moment, which is great. So not to be in pain with them is a bonus.
Yeah, absolutely.
I remember having one infection, which is right down in the root, I think, and going to A&E and literally in the middle of the night because I couldn't do anything else with the pain. I'd taken kind of the maximum amount of cocodamol that I could take, and I was like, I can't physically cope anymore. My mouth was like out here, swollen. I just didn't know what else to do, because what can you do? It's like horrific, just horrific, some of the pain that you go through when you've got bad teeth, I guess.
Mm-hmm. But Rhian, thank you so much for taking some time out of your day to sit and have a chat with me. I really appreciate it. You've shared some brilliant advice, and it's nice to hear that you've had a good dental journey with your dentist as well, and he's been really supportive of helping you, and that you're well on the road to recovery now is lovely to hear as well.
No problem.
That was Rhian there sharing her eating disorder journey with us. Thank you once again, Rhian, for coming and sitting and talking to me. It's really, really appreciated. I know I learned a lot from talking to you. If you are listening and you want to know more about eating disorders, or you want to access eating disorder support, please visit beateatingdisorders.org.uk, or you can call their helpline, which is open every day of the year, on 0808 801 0677. For more information about National Smile Month, please follow us on social media at Smile Month and at Oral Health Foundation on Instagram. You can also follow at Dental Health Org on Facebook and Twitter. And if you'd like some dental health advice, please call our helpline. The helpline number is 01788 539 780. Thank you for listening, and enjoy the rest of National Smile Month.